Hello and welcome to the Hardy Brain, the show that takes athletic, introverted entrepreneurs and leaders and transforms them into ironclad brain performers. I'm your host, Dr. David Hardy. And today on our show, we've got another amazing guest. She is a neurologist. She is the founder of Memorability and the co-founder for the African Brain Health Network. Welcome to the show, Dr. Kirti Ranshad. How are you doing today?
Thank you, David. I'm doing well, and it's really lovely to be. I'm looking forward to the conversation.
Absolutely. Well, this is exciting because it's a different global perspective on brain health here. And yeah, brain health, it's such a wide range of conditions that affect so many people. I've heard the numbers being up to something about, oh, $3 to $5 trillion spent globally on brain health, which is so many different conditions from your neurodevelopmental to your mental health to your brain injuries to decline. How does this kind of fit in with the work you're doing in South Africa, and what sort of areas are kind of front of mind in that area and perspective in the world?
So I think first, I think just to review how we could approach brain health in different ways. So the one does look
Hmm.
at disease and diseases that affect the brain and how we can potentially reduce risk or prevent. And the second aspect would look at people who have an illness already. How do we support people with a brain disease? How do we make their lives better? Or yeah, how do we support people basically? And the third
Right.
aspect would look at brain function. How do we look at the brain and realize, I'm biased, but how do we look at the brain and realize, well, it does everything we need to do? Like, it really does control our heart rate, it controls our breath, it enables us to move,
Yes.
helps us make our choices when we fall in love, rightly or wrongly. But how then do we support the brain functions to actually help us to live the lives we want to live? So there's the thread in terms of how we look at brain health, and then
Right.
given that there'd be different approaches within context.
You're speaking my language here because so much in healthcare and is about a diagnosis. And we know in the brain field, by the time you're diagnosed, it's a far gone condition usually, especially in ones that are more life and death, right? And that, yeah, function is everything. And there's a continuum from peak performance to diagnosis and disease that's not being addressed here. And yeah, when we talk about brain health, we should be talking about performance in the same breath because how we're performing dictates how we'll age, how we'll decline, and also what's going on right now and how we live our lives. And I love how they're putting everything together into brain health and then into brain capital, but there's such an overlap with the two. Now, you've spent your career here transforming neuroscience into practical solutions to optimize brain performance. So, how do you do that? I know this is your mission and goal. What steps do you take?
So personally, what steps do I take, or what do you mean? How do I transform it into practical steps?
Into practical steps?
Practical steps.
Absolutely.
Absolutely. So I think one of the things that happened was I started looking at first dementia prevention strategies. So that's how I started looking at it. Um,
Mm,
and when I looked at dementia prevention strategies, there's actually a long list of things that people need to do to reduce risk, prevent dementia, or potentially slow progression down. I was one of the doctors who would actually discuss with patients when possible in terms of what they could do to reduce risk, what they needed to do to manage better with a specific disease. But what I realized was that I'm just giving information. And for the most part, people know the information that I'm giving them, often, not always, but often. That you need to sleep better, that you need to eat healthier, that you need to exercise more. So
right.
information does not necessarily translate into practice. And I realized what I had to do then was actually create really practical, engaging activities that, especially initially, are easy to do. You can add complexity as you go along, but especially initially, you want it to be really simple for people to do, really simple for them to start and incorporate this into their day so they don't have to think too much. So it was taking the research that was already published. There was such a wide, there was so much information already published, and making that really practical in terms of what people could do.
Okay, well, what's an example of that?
So, one of the examples would be social interaction, because social interaction,
Hmm.
keeping socially engaged, has this profound impact on the brain. And initially, when I thought, well, you're surrounded by people you love, you feel better, you feel better. Obviously, you have a reduced risk of depression, and you also have a reduced risk of dementia. But when you look into the science behind it, what happens is that when you feel loved and understood, or when you have a supportive network around you, it switches a specific gene on. That gene then results in an increase in a chemical in the brain, which stimulates growth of the brain in the memory and mood part of the brain. So, actually feeling loved and supported changes gene expression, changes the physical structure of the brain. Now, isn't that profound just from a science point of view? It was just like, oh, wow, this
Yeah.
is magic, actually. But now, how do I make it practical? It's a bit impractical if I just tell you you need to spend time with people you love, right? It's not impractical, but I mean, it's people know this. This is not, and I think it's becoming harder in this era currently. So, what I would do then is actually structure very specific activities to encourage a form of social interaction, particularly initially, in this brain health framework, and build from there. So I wouldn't just say, this is what you have to do. I give you the specific tasks that would help you, or activities or experiences in terms of that.
Okay. And how does that apply to exercise then, too?
Exercise would also, so you'd look at different concepts in terms of how to make it practical. So, how much time do you actually have? What are you actually going to do? Like, we all have this ideal, yes, we're going to do what the doctor recommends, 120 minutes a week. This is what we are going to do. Practically, we understand this is not happening for many of us, which is why we have the problems we have. And so it becomes about understanding context of the person, understanding resources available to the person, and understanding what then the person can actually do. And by resources, I also mean time. I
Right.
also mean there's some people who, in specific environments or cities, are already walking a lot. Is that enough exercise? And so we actually focus then on a different area for brain health. If I know that you're already walking 10 to 20 minutes to get from to your workplace, for example, it means you already are doing enough exercise. Do we need to look at the whole and say, actually, you need to spend more time with people you love, or you need to stimulate your brain in a different way? So that's the way you look at it in terms of making it practical and relevant to the actual individual.
Hmm. Okay. Now, I like how you kind of put in somewhat of the terms I use all the time, which is frequency, duration, intensity. And yeah, a lot of people they see the health gurus and they think, "Oh, I need to do high intensity or I need to do long durations of exercise for it to be effective." But really, our brains and bodies were designed for short little dosages of stimulation or bursts of excitement and movements. Um, how do you kind of see that with different conditions in the brain and what somebody should be doing so that they get this theme of, okay, well, this is kind of the appropriate amount of stimulation or exercise. I use them almost interchangeably that someone should be doing.
Look, so there are specific guidelines, and then, like you said, there are trends in terms of what gets promoted. But there are
Hmm.
specific medical guidelines in terms of minimum exercise that is recommended. But if we do make it practical, it's starting where you're at. If
Right.
you are unable
And
to
is that
run
in
a
the guidelines?
kilometer, sorry,
And that's not in the guidelines, though, is it? Start where you're at.
no, no,
Never is in the
no,
guidelines or
no, never in the
recommends.
guidelines.
Oh,
But
it's
we
missing.
have to start practically. Yeah, so if you can't, it's about understanding what you're able to do and what's fun. It doesn't have to be the gym, it doesn't have to be
Yes.
running a marathon, it can be dancing. It's about trying to, yeah, like I say, so we make it practical for you in terms of how gets done.
Okay. Now
And
you
also
just
I want
mentioned
to also add,
yes.
in terms of over time sustainability becomes important as well,
Absolutely. So
and so
developing
that's
those
quite
habits
critical,
to do it.
developing the habits.
Yeah. Now you mentioned dancing, and I know you're big into cultural stimulation as well. Uh, so I know you've researched this and that you promote it. But what are some of the ways that culturally humans have been doing really good things for their brain health? And it kind of goes unnoticed with all the, oh, I don't know, uh, prestige of medicine versus, no, there was some cultural trends and ideas and customs that really built good, sustainable brain health in a lot of people for centuries and in challenging times too.
So, given that I started with social interaction, let me go back to that one in terms of the example. Our gatherings, our celebrations
Hmm.
would be a powerful example of that, right? So, whether that is a Christmas or a Diwali or an Eid, like whatever religious or cultural or spiritual traditions we have, or even the not what's the word now, even the secular celebrations that we had,
Hmm.
like celebrating specific days in the country that you're from, example, for
Okay.
example.
Yes. Yeah.
So those those events or those celebrations allow us to gather, and we are going to actually meet people we like and dislike, and actually that's the beauty of it, in terms of not just spending time with people you love, but also building relationships, understanding how to deal with conflict, understanding what you can tolerate and can't tolerate, understanding how to communicate to many people. So you're automatically stimulating your brain. And so the thing is that you have
So you're
these
saying getting
cultural
angry can be a
celebrations.
good thing?
No, I'm not saying getting angry in a public situation. I'm saying how to communicate effectively.
Fair enough. Fair enough.
But I think sometimes we only look at it, we often look at it as a chore, as something that has to be done, as to, this is so much
Right.
work. Sometimes, not always. But
Hmm.
but we don't look at it as this is necessary. It's valuable by itself. It's valuable just to enjoy yourself with your family or your friends, or however you are celebrating whatever it is that you're celebrating. But beyond that, there's actually a set of skills you learn from these group interactions that you then use in other group interactions, which helps you then to form these communities of support that you need. And these communities of support keep your brain healthy. The other example that I like to share in terms of what we already do that we potentially ignore is a form of mindfulness that is embedded differently across different traditions, cultures, countries. Um, and that is prayer. And prayer in different
Okay.
forms can
Hmm.
be a form of mindfulness, depending on how it's done. And so these sacred or spiritual cultural traditions have value obviously beyond what I'm discussing. I'm discussing it as a neurologist thinking about the brain. But mindfulness is that quiet, focused attention, trains your brain in specific ways, has very specific benefits as well. And if you look at prayer in terms of the way it has been encouraged across different traditions, like I say, it is actually a practical form of mindfulness. But because we don't put the term of prayer with mindfulness, we often forget that we may have
Right.
this resource already embedded in our societies.
Well, too, some people they don't want to take on that religious aspect of things, so
No,
they
no.
do something similar without that
And that's perfectly fine as
obligation, I
well.
guess.
Yeah.
Absolutely. But with that being said, a lot of major religions do have health practices in their religions. And yeah, it's usually around diet, it's around socializing, it's around activities not to do. Um, so, how does that play out with some of the cultures or practices that were in a lot of sub Sahara African cultures? What sort of things? I know, like, people go to like Buddhism and Chinese traditional medicine as well, that's been around for thousands of years. But each culture had something like this in place. Am I correct on that?
Yes, and still do. And obviously, with time, history, things change, things adapt. Um, but yeah, so a lot of the work I do is inspired by both my culture and the many cultures that I'm surrounded by. Again, going back to having started reading all this research that was published, I understood that there was already a parallel embedded in these different cultural systems. And so instead of saying, well, I'm going to teach you mindfulness or social interaction, the XYZ, I'm actually going to look what you already have in your culture, your community, or your family that could potentially support this. So I come back to the mindfulness exercise because it translates
Hmm.
across different cultures. But I also I don't want to say that this is the only practice. I agree with you. The secular forms are also powerful. Okay, so I'm just using this because a lot of people practice this in the environment that I'm in.
Oh, absolutely. Yes.
Yeah, so like within my traditional culture, it is lighting a lamp to your god or your goddess and saying your prayer, which with focused attention. In Southern African cultures, it's lighting a candle to communicate with your ancestors. Um, and in Catholic traditions, it's going into the church, lighting a candle, saying your prayer as well. And again, I can give so many examples actually of lighting a candle or a lamp in different traditions and communicating or sharing, but focused, quiet attention, and and that then becomes mindfulness.
Right. Well,
Yeah.
there's something hypnotic as well. Well, I should say almost hypnotic about candlelight or campfires. And yeah, light is a stimulation to the brain. So now you've got this cultural, religious, spiritual perspective on top of kind of the things they found or accidentally were using that were also kind of soothing to the brain. And am I on the right track with that as well?
Yes, exactly. So I think that what some of what I do, I think it's like the neuroscience is explaining how
What we've
these
been doing.
activities, yes, but
Yes.
it was understood that these activities had benefit, just
Right.
not the neuroscience or the health benefits in terms of the way we measure currently, but that these activities had benefit was understood in these various cultural systems, no matter how you look at it.
So subtraction is also part of things. So what things have you come across that people need to take out of their lives then as well?
Good
Loaded
question.
question,
I'm going
right?
to actually have to think. Let's see. What would you take out of your life? Uh I would take out an over dependence on our mobile phones. I think it has
There we go.
actually had an impact on our social interactions on so many different ways. Because part of how we build relationships is understanding who we can trust, who we can depend on, who we can ask a question. And I'll use a simple example again. Um, Before, when I wanted to know how to make something in terms of a recipe to cook, I had to phone somebody or I had to go visit somebody and learn from them or ask them, which built relationship, it built communication, it built trust, it built me getting invited again or I me inviting them again. So it automatically
Right.
built that
Yes.
support system that I needed. Now I go onto my phone, I decide what recipe I want, I read the recipe, I make it, it comes, it may or may not, come the way I intended because I don't have that expertise actually. But what I've missed in the process is building relationship. I've missed the stories that come from actually engaging with somebody who tell me how they first did it, the value that we actually get in building relationships. And it's those little things that we all do. Me too. Like before, if you got lost, you had to stop, you had to figure out who you're going to trust, and you had to ask for directions. But again,
Yes.
it meant you had to learn who you could approach. We've lost that, right? We're never going to ask anybody anymore unless you forgot to charge your phone. Uh, but all of those little things actually have an impact both in terms of the way we use our brain, the way we build relationships, and the long term impact. Yeah, yeah. So I would subtract how much we use our phones
Is there
or
anything
devices.
else that you think would be good that we'd use less of or not at all?
Less of or not at all. Yeah, I think currently a lot of it is still related to tech devices that I can think of in terms of what I would subtract. What else would I subtract? Um, no, I think that's where I'm at in where
Mainly
my
tech.
brain is at.
Okay.
Yeah.
Now there
May I ask
in
you, what would you subtract? I'm
ah
curious.
right. I'd subtract the toxins in our diet and food supply.
Oh, this is
I
true. I
think
agree.
I, I think the food supply needs an overhaul, and yeah, and that goes too into another substance we need all the time, which is clean air, clean water. So we definitely need those in our lives as well, and I think that's kind of the low hanging fruit right now is to make things just healthier. And then yeah, I think society and the way a lot of jobs and everything are set up is almost evolved or is intentionally there just to stress people out. And yeah, there's good stress, there's bad stress, but a lot of it is pointless stress. And it's up to the individual to do that. But there's definitely something behind that when we're talking about, okay, well, what sort of world do we want to live in the future? One where it's not
Completely.
pointless stress. And
No,
yeah, I
completely.
think
Couldn't
tech
agree
plays a
more.
big part of that as well. Like tech should either work or be thrown away.
No, no,
Yeah.
excellent suggestions. Couldn't agree more with all of them.
Now, you co-founded the African Brain Health Network as well. And I'm really fascinated on kind of the work you're trying to do there cuz yeah, it's a group, as you put it, of artists, activists, academics, community workers, clinicians, caregivers, economists, neurologists, nurses, psychologists, psychiatrists, and public health professionals. So, one, like all of those are usually siloed areas, and you're trying to put them together. So, what is kind of the goals, and what have you seen accomplished with this brain health network?
Yeah, so it's been beautiful and it's been challenging, right?
I would
But it,
imagine.
because one of the things about a siloed approach is it means all of you have a common goal, a common approach. So there's a direction. Even as if there's a disagreement, you already have that commonality built into the framework of thinking and doing.
Right.
Um, but I did a fellowship with the Global Brain Health Institute. I was in Dublin. It's part of the Atlantic Fellowship Group. And that
Hmm.
fellowship was also diverse in terms of disciplines, so economists, artists, etc. Um, and so when we started the organization, it was part of that. Like we were fellows from that community, so we were already diverse in terms of disciplines, and it was then how do we take it forward? And so it was a natural progression in terms of that, but it was
Okay.
also recognizing that because brain health is really quite broad in approach and thinking, and it's a relatively new field, you have this incredible opportunity to work across disciplines
Yes.
and bring out the magic from all these different disciplines and hopefully create something you couldn't have even have imagined before you got all these people in the group together, you know so it's been really, really, like I said, it's been such a beautiful process to allow this organization to grow and to look now at we now at specific stages in terms of how we're going to support brain health in different ways, understanding again the resources we have, understanding that we need to build as community to actually support brain health. Yeah, so it's just been very interesting to get these different perspectives because I think particularly when you go through specific training like neurology, and it goes for all the different disciplines, I'm just using mine as the example, you have a very specific framework of thinking and problem solving and imagining, even, right?
Yes. Yeah.
Which is excellent. Like, I love neurology, I love the framework, but having that different inputs just means we get to hopefully do something that is extraordinary. Yeah.
Right. Yeah. Yeah. I love that example. Like different lenses. Like in functional neurology, we use the medical neurology examination textbooks, but we read them differently. Instead
Mm.
of reading them as a diagnosis, we read them as, oh, here's the pathways to why stimulation is going to improve or not improve somebody's brain. And then I see that being the framework too of, well, then how do you get art and all these other areas involved in brain health? And it's knowing how the system's working and functioning versus traditional medical models that don't work for the brain and neurology. And so I love that example. Now, you also have another company, though,
I do.
Memorability.
Yes.
And I'll let you kind of explain to us what's going on there, because I know it's entrepreneurship and business that's going to make the changes in this world.
Yes, that is a company I founded again to support brain health. I realized that it was, on some level, going to be more practical to actually create what I wanted to be able to do. And
Mm,
at that stage, the systems would not have allowed it in terms of what brain health, etc. And so that's how I started the company. And for that, again, it was responding to what I was explaining, that you can have all this theory and you can explain this also in a way that people understand. And a lot of people do understand it, but at the same point, it's about how do we make it really practical? What is the process behind specific activities that can actually then support brain health and behavior change so that it becomes sustainable? So what I've designed is a specific brain training program using a brain skills model. So, specific skills, and then we train the brain with specific activities, but attached to a process. The process is as important as the tool. Yeah, yeah.
okay.
And A
Yeah.
large part focusing on stress and anxiety and mental wellness currently, given the current crises that we have across the globe. Like the stats are remarkable. The stats suggest we should not ignore this, and we have to we have to actually respond at different levels: individual, organizational, national, to have meaningful impact. And we're going to need investment in all those levels as well to result in change. But post COVID, what has happened is just phenomenal, not good, phenomenal,
I
And so
hear
it
you on
really
that.
is.
Yes.
Yeah.
Yeah.
Yeah. Now we transcend
Yeah.
that.
Yeah. And to anytime there's disruption and things get ugly, and it really is time for brain health to become a focus because,
Mm.
well, once again, the world's changing and changing very fast, and people aren't at a state that they're healthy, for one. And two, it's going to be more stress on top of it. So I really applaud you with the initiatives and everything you're doing to improve people's brain health, function, performance. So, how do
Thank you,
people
David.
find out more information about you? How do they reach out to you?
My website is memorability.co. So on the website, there are the courses that I have available online, my contact details, including the ability to book a short discussion if people are curious or want to understand more before actually um, taking on a program. And I would do work with individuals or groups or corporates in terms of that. So that's the best way. And then to follow Memorability on Instagram or LinkedIn, where I also publish different accessible ways of keeping the brain healthy.
Fantastic. So look up memorability.co and reach out to Dr. Ranshad. And of course, stay tuned to the next episode of The Hardy Brain, the show that takes athletic, introverted entrepreneurs and leaders and transforms them into ironclad brain performers. Take care.